So really just being able to disconnect from everything and say, okay, no matter what, we are having fun for a little bit of time in this day.
Yeah.
And then enjoying that time because it goes by quickly.
Mm-hmm. Everyone should have personal visions for their life. Like, you should be thinking about, what is your personal vision for the different areas of your life. So oftentimes when I start with someone I don't know at all, I start with the personal vision. Like, out of these, like, spiritually, physically, mentally, emotionally, where do you have a vision? Or
where are my biggest visions, maybe?
Yeah.
Well, I'm looking at the list, and sobriety, that's not an issue for me. It never has been. Family really stands out because I have 3 kids and a husband, and my whole life kind of revolves around them and their joy and stability. So that's a big vision, to continue that.
Okay,
especially the kids feeling stable in their lives and happy. Like, I feel like that's so dependent on me.
Yeah.
So that's big.
Well, let's just go there because we don't have time to address one thing.
Okay.
So when you think of family, you're the mother in the family, right? What kind of mother do you want to be?
I want to be a mother that my kids know that they can depend on.
Okay, so dependable.
So if they need me to show up at school and do something, I'm there for them.
Right.
Fun is important because I think, childhood, part of it is simply having fun.
Yep.
They don't know about what happens as an adult, so having fun is huge, and I want to have that fun with them. And I want to be someone that they look up to. So they see me working hard, caring about other people, trying to care about myself, like what I'm eating, am I exercising.
Ooh, that's important.
I want to be an example for them.
So you want to be a dependable, fun, hardworking, self-care mother who is an example to her children. And what about as a wife?
As a wife, I think it's important that I show love no matter what's happening. Unconditional love.
And that would probably go for your children as well.
Definitely, yes. Oh yeah, that's a given, I forgot.
Right, that's a given, right?
Yeah.
We don't always unconditionally love our spouse, but...
Right, that's more of a challenge than the kids, right?
Yeah, absolutely.
Being honest, yes.
Absolutely. So what actions are you currently taking to be that kind of woman?
I don't know. I haven't even really thought about that. I mean, as far as dependability, I have a calendar and I try to be organized so that I can be where everyone needs me to be all the time. And then as far as fun goes, I try to unplug and disconnect from everything I need to do in my day and my world and just have fun. Like today after work and school, I have plans with 2 of my 3 kids. My son and I are going to walk the dogs in the cold. We think that will be fun. And my littlest daughter
You've convinced them that will be fun.
Yes, we're like, we need to do this, and it's going to be fun. And then my youngest daughter and I have a 15-minute session to get our room picked up, and then we're going to make bracelets because that will be fun. So
15 minutes of work.
Yeah.
Planned, and then some fun.
And then fun, yeah. So really just being able to disconnect from everything and say, okay, no matter what, we are having fun for a little bit of time in this day.
Yeah.
And then enjoying that time because it goes by quickly.
How old are your kids?
11 and 10 and 8.
Okay.
And the big 2 are about to have birthdays, so they'll get older. It's happening.
Then you have to add a year.
Yes.
Moving.
Yeah.
Every 2 years.
Ish, yeah. Sometimes more, sometimes less.
Okay.
And I think there's a lot of military spouses in our community that watch Loving Living Local that have the same barrier.
Yeah.
Because right when you get set and you've kind of have your action plan in and you're going strong, it's like, oh, just kidding, time to go.
Right. And connections, as I'm sure, it takes time to make connections.
Yeah. And for the kids to feel comfortable is a big thing. And I think we do better as adults when we have strong friendships and a community to depend on too. And a
And
job.
what do you do when you go to a new community
Well,
to try to connect?
Anything I can. I mean, if I can find a job right away, that's also a barrier.
Okay, but you like working. That's part of the example that you want to set.
I do like working. It's fulfilling, and well, making money is important in 2023 when you're trying to feed people.
Yeah.
So I think getting a job helps because then you're immediately in social settings where you can meet people. So that's a great way. But I also try to connect with the parents of my kids' friends.
Okay.
They
School
usually,
parents.
yes, or activity parents. They usually become my circle and my friends.
Okay.
Because we spend so
Those
much
are very
time together.
practical
Approaches.
Yeah.
Yeah. If I don't get a job right away, volunteerism is a thing. Sometimes some of my self-care, I'll make friends. If I'm going to a regular exercise class,
Okay.
I would make friends there.
So you do like group exercise?
Okay. I do. If I do it by myself, I probably won't do it.
That's my struggle too.
I need someone to tell me that we're doing this at this time and show up. And I'm like,
show up,
yes, yes, and pay for it because then I'll go.
Yeah. What other barriers do you have to being this woman that you want to be?
I think I run out of time. You know, there's only so many hours in the day, and you know, my to-do lists are sometimes overwhelming. The holiday season's a hard time, especially because there's all that extra pressure to do all the extra social settings and the gift buying and the family visiting, and we run out of time and energy too. So I think that's a barrier.
Okay. What about an internal barrier?
An internal barrier is not believing in yourself. Can I do this? Am I good enough? Am I doing things the right way?
Talk to me about that, doing things in the right way. We talked a little bit before we even got started. Is it right to make a resolution or not make a resolution?
Well, I mean, at this point in my life, I've experienced a lot of things and a lot of different ways of doing things. And, you know, you grow up thinking, oh, this is the way we're supposed to do things. And then you go out on your own and you're like, wait a second, there's other ways. And I think I'm just better at this way. So working through that's a lifelong process. And I'm still trying
kind of
to
like
figure that
balanced
out.
thinking.
Yeah.
What happens in your mind when you make a mistake?
I think I obsess over it. I think about it a lot.
Okay.
And then eventually I'll come to, well, what could I have done differently? But it lingers.
And what kind of things do you say to yourself?
You know, why did I do that? What could I have done differently? How was I feeling when I did that, made that mistake? Was I tired?
Is it mostly physical things? You know, like you said, I'm tired. But do you ever think, I'm not good enough, I can't do this right, I'm not smart, I'm not...
Yeah, or maybe, of course. Or like, you know, I'm getting a little older, so sometimes I think, well, I don't, you know, my education's old. Like, I learned this so long ago, do I still know it? Or is there a better way to do it? Or I think about that too, sometimes.
And what is you said of course, right? But I think as women, we have this negative dialogue in our head and we think everyone knows it or doesn't know it. Like we think it's just ours. But what I'm realizing is that 99.9% of the women that I interview have some negative dialogue around things, and oftentimes they're the same as everyone else. Do you think you have some of that?
Yes, of course.
What word would you give that?
I think maybe just like you can't or you're not good enough. When you said those things, I think they resonated.
Okay. So that's between those two. How often do you say to yourself, I can't do this. It's too much.
Daily.
Okay. So that's what we're what we call MAP. So this is where I want you to do some writing. After you write, if you tap it and hold it for a second, it turns.
If it can read my handwriting.
Yeah.
Okay.
So just recently,
okay,
what situation did you say internally, I can't?
I mean, even this morning, like I can't get out of bed. And, you know, I had to wake up early to do some things that didn't get done last night. And I was like, oh, I can't get out of bed. But I did.
Right. So let's say can't get started.
Okay.
It's because that's probably more of the,
Yeah.
you could physically probably get out of bed, but I wonder why. So what is that weight? Because I've experienced that. Like, it's like almost like a physical weight. It's an emotional weight, but it feels physical of like, oh, I don't want to get out of bed, or I don't want to get started. I know I have to. I just like you said, if I have an appointment, I will do it.
Yes, of course.
But what is the emotional weight? What is behind that?
I don't know. Maybe just too much to do in the day.
Overwhelmed?
Yeah.
Okay, we could put overwhelmed there.
Okay.
Is there fear, anxiety about performing?
Not that much. I feel like once I get going, I can do everything well. It's a matter of like being organized. And I do have concerns, like if one thing goes wrong and throws the whole day off, that's anxiety, right? Yeah.
Okay, so some anxiety.
Okay.
Any sadness, depression that creeps up?
Probably not.
Okay. So more performance-oriented, wanting to be that person?
And just like I mean, I'm really, really busy. Like I have a lot going on in my day. So the stress of that alone, it's just it's a heavy weight.
Yeah,
you know,
just stress. Absolutely. What about in your past when you've said, I can't? Like this
morning.
And like you said, probably every morning, right? We all have moments like that of just, you know, especially when something goes wrong and you have a very packed day and it's, and then it, you know,
it's
kind
stressful.
of, very stressful.
I think a consistent I have in my life is every time we have to move. I'm like, okay, I can't do this again.
Move.
Okay.
That's a big one for you, absolutely. Yeah. And what part of moving makes that I can't?
There's layers to it. So I think the first thing that comes to mind is just the logistics of it. Picking up all the things and everything you own and keeping your fingers crossed it gets to the next destination and that you have a place to go when you get there. That's a huge stressor.
Logistics, absolutely. Okay.
And then secondarily, it's heartbreaking. I mean, we're leaving.
Ooh, that's a beautiful word, heartbreaking.
We're leaving people that we love and that love us. And then, you know, will you see these people again? And how often? It's just a part of you're closing a chapter, and that's so hard.
A lot of grief.
I think there's fear and anxiety of the new place. Will we find places that we fit? You know, will I find a job I love? Will the kids find a school that they love? So the fear of moving forward. Do you like the word fear?
Fear or anxiety, whatever resonates more with you.
I'm going to say.
And let's add a few things specific to the role that you play with your children in the move. What is that? What kind of feelings does that bring up?
Well, I'm their consistent person because my husband, when we move, he has to go immediately, usually to do what he's doing, and the kids and because he's moving from his branch of service to his branch of service, there's
consistency.
Maybe I've never asked him, but it seems like consistency and smooth transition. And when he gets there, people know him; they're expecting him. With us, it's like we look around and we're like, we don't even know where we are, what we're doing here.
Right.
So I'm their constant, and that's a lot of responsibility. That's a weight that you feel.
Well, responsibility of their mental health in that.
Yes, when there's tears at night because they miss their friends and this and that, it's me. You know,
which is more heartbreaking for you as well.
Yeah,
absolutely.
It is heartbreaking.
Yeah. What about even further back? Maybe young adult, late teens?
I don't know. I felt like when I was younger, I felt like I could more. My dad did pass away when I was a teenager, and there was an I can't there.
Okay.
Like, 'cause I
Is
had
that
to-
like the first time you feel like you encountered an I can't?
Yes.
Okay.
That I remember.
Okay. So, but your dad's passing.
Okay.
Talk to me about that grief.
I just know that I wanted to like pause and not like there was so much happening when you're a 16-year-old girl, right? There's high school and cheerleading and friends, and I felt like I just wanted to pause and that I couldn't do anything I was normally expected to do. And that includes even just going to school,
Yeah.
you know. So definitely that was a time that I couldn't.
Did you feel like it was a lot of shock? I mean, what were the circumstances around his passing?
Well,
Was it expected? Was it?
I think we knew for 3 months. He got cancer and then he quickly passed. But I don't think at my maturity level at that age I was able to process what was happening, even with the warning.
Right.
So at the time, I think it was sadness. I don't think back to that time and think I was shocked. I think I was just sad.
Sad. Okay. And how did it change you? Like we talked about how you were this bubbly, I can picture you. This
Yeah.
like bubbly teen, probably lots of friends. You seem to be able to connect with people. And this shocking, unexpected, very sad thing happens to you. How did that change you?
Well, I think it might have changed. I don't know. I do think it changed me for the good in ways. There was such a wonderful community around me of people that were willing to support me. And I don't think I was mature enough to realize that until that happened. So that was a good thing that came out of it. But I had just never experienced anything like that before. I didn't even know that sadness existed. So potentially I didn't even have the compassion for others that were dealing with things.
Oh, compassion. So you gained compassion. Wow. Okay.
And then I had a world of responsibility from that time forward because my mom continued to work and she traveled internationally for work. And so I was at home by myself as a 16-year-old.
Okay. So now you had to become an instant adult.
I don't think I acted like an adult at all by any means, but I was given responsibilities of an adult long before I should have had them. But that was the situation we were in.
Yeah. So, responsibilities of an adult.
Okay.
Yeah. And that makes sense why this was your first I can't. That and now when the responsibilities get too weighted or too much, that's the first words that come to your mind. But you know you can.
Well, I mean, clearly I've been doing it for a while. But still, you question, like, am I doing it well enough?
Right.
It's easy to compare yourself to others that just look like they're doing it better.
Right.
You know?
But they're also not being open about what's going on the inside and those kinds of things.
That's
I think
fair.
if we could start all being honest with each other about how hard it is mentally just to be who we are and the responsibilities and the expectations, that we would all be a little more connected, you know?
Or a little easier on ourselves, maybe.
Yeah.
'Cause
And
we're
it wouldn't
hard.
feel so much stress and
Yes.
anxiety around it, right?
Because we're hard on ourselves, aren't we? I
Yeah.
am, yeah.
Yeah, I can see that. I would, when I say the word perfectionist, does that resonate with you?
It does.
Like even into your childhood?
Yes.
Yeah, I want you to put that there. And it's just something I can see in you.
It's like a competitive spirit, like the pressure of being perfect and being good at everything.
So when you can't be perfect,
You're failing.
you resort to this negative
Yeah.
dialogue.
Yes.
Yeah. Tell us a little bit about that in your childhood, being a perfectionist, and how that's maybe still resonating now.
I was the youngest child, so I don't know. I just
They
looked-
told you were perfect, so you
they probably treated me like I was perfect, so that just resonated, and I'm like, oh, well, then I am. Is that a thing?
It's a thing, yeah.
Yeah, I feel like, yes.
Or it could go the opposite. Like, then there's some people that feel the opposite, that they are nothing, they're not perfect at all.
Yeah, I definitely think that if you talk to my family members, they would say that I was raised to think I was perfect. Yeah.
Okay.
Is that a thing?
Well, I think it causes this. It causes the stress and anxiety when you can't be perfect, right? Because no one can.
Right.
Yeah.
That's so true.
So being able to manage those expectations and those kinds of things. So nothing resonates with you as a child of like, I can't, like when you, tell me about like, did you do extracurricular things, school? You did really well in all those things.
I did. Up until this happened, then I really stopped doing school altogether. But at that point, I was a junior, and I could just kind of slide in with what you know what I mean? With the work I had already done, and school came easy to me.
Okay.
So that was that situation. I can't think of a time when things weren't perfect early on. You know?
You have this very distinct line in your life that happened here.
Right.
Okay.
Yes, and everything I did, school-wise, extracurricular, all the things you think about, like homecoming this and friends this, it was all very much in line.
Yeah. And what did you do to grieve your father?
I slept in. No, I'm serious.
Physically, you let your body
I would
process.
call the attendance office. That's what we did back in those days. And I'd say,
pretend to be your mom?
No, my mom was gone and everyone knew it. So I just said I was myself and that I was going to be late or absent for the day. And that's what I did.
And did that for 2 years?
No, I only did that for a year.
Okay.
And then I came out of it.
Yeah.
But I never went back to school like on a routine because by then it was my senior year and you have shortened hours. So
what did you do with the sadness though?
I don't know. Probably pushed it to the side.
Okay. Probably.
Yeah.
And then the last question I ask here is, how does this relate to your relationship with God or whatever you call the power outside of yourself?
Well, I did grow up Catholic, and I do think that core helped me with this situation. And I do think at the end of the day, even if I'm not perfect, I'm loved by God, and I do believe in a higher power.
Okay, so it's helpful. Okay.
Yes.
So just say your, maybe your faith is helpful, or okay. So did you learn anything from just this process, putting it on like in a big board in front of your face?
I know, I'm kind of afraid to look at it, but at the same time I'm not, because I've never thought about it this way. And we're doing this in a short time. Imagine if I like thought about it over days and a week.
Right.
There would be so much more that would come up. But when you drew the line and you said, this and this makes sense to where I'm at now and the feelings I'm having, that really connected for me.
And when's your next move?
Well, we don't know. We're just on edge, waiting to find out.
How long have you been in Colorado Springs?
2 years.
Oh, so there's a lot of anxiety of when it's coming next.
And where we'll go.
Right.
Yes. Yeah. That's a big one.
A lot there. So one of the things that makes the Mentally Strong method different than other cognitive behavioral approaches is the way that we organize it. I mean, we all know that we have these things going on in our head and that our past kind of impacts, the way we think. This was helpful to see this clear line. I don't think we grieve properly in our culture.
I don't think I grieved at all.
Yeah.
I have to be honest. I don't know what I did.
Well, you did you didn't have anybody to help you either, and you're a perfectionist, so you just kind of skated by for a couple years, then pulled it together and moved on, would you say?
Yes.
Right?
Not even a couple years. I think I pulled it together pretty quickly.
Yeah.
Yeah.
So there's definitely, if you wanted to do just some time around that grief, what I tell people is, regardless of the grief, even how long ago it was, taking time for what I call controlled grief. Like you take a moment, let's say his birthday is coming, and you say, hey kids, I want you to meet my dad.
Okay.
And you get out pictures of your dad, and you just spend time. I'm getting choked up. Like, you just spend time, like, sharing your dad with your kids. Like, you know, and yeah, you know, you get a little sad, but it brings it to the surface, because we can't change these things.
No.
Right?
Or we would have already.
Right. If we could have made it perfect, we would have done it. But grief is about cherishing that relationship.
Okay.
And, you know, bringing it, moving it forward. You know that you're going to see him in heaven, right? But how much is he still a part of your life now? And can you take time, you know, once a year, or even every couple of years? It's not about a specific amount of time. It's about, wow, I never actually felt this pain properly. You know, what can I do with that now? Because it was a very clear line that changed how you approach the world. Like, you didn't have any anxiety prior to this.
No.
And I mean, you know, most adults in real life have anxiety, but most of us have something also that caused that. This changed your perception. Not only did you think you were perfect, but you thought you were safe, your family was safe, you know, and those kinds of things. And now you realize
that's not true.
Nobody's really safe from hardship. And so just taking a little bit of time to go back and do some of that grief. But what's happening right now, you know, we have the anxiety, right? And there is this is just a negative thought.
It's true.
And you know it's a negative thought, and I can tell that you just do a lot of self-care, self-work. Like, you try to take care of your mind, and you don't want to have negative thoughts. What we do in the Mentally Strong Method is we actually put it on a sheet like this, so that we can make a choice based on this. What I noticed a lot of times is that a self-help book will say, oh, you just think positive, and positive things will happen. You know, the manifestation that we talked about.
Yes. Which
is great, but it doesn't really help us understand what to do with our triggers or what to do with our grief. Okay. And all of these other, you can imagine if somebody had a lot of either complex trauma, complex grief, or different things, there would be a lot more here. For you, the I can't, right?
Okay.
I want you to rate that. 10, truly believing that you can't. 0 meaning, so on that 0 to 10 scale.
Let's say a 5.
Okay. Any other negative thoughts that didn't come up that might be associated with that?
I gave you another one, but what was it? It was I can't. And
not good enough.
I'm not good enough. That was the other one, yes.
Mm-hmm. And I want you to know that I haven't talked to a woman yet that didn't have that.
Really?
I mean, we really struggle with that. What would you say?
A 5.
Your anxiety about, I would say, like, doing the right thing, making the right decisions.
Or just the day-to-day, too. Adulting, as we call it.
What is your anxiety on a scale of 0 to 10?
5.
Okay. Never gets higher than a 5?
Not today. I feel pretty good.
But that wasn't the question. Never.
No.
On your worst day.
It does get, a 10 on my worst day.
Okay.
Yeah.
And this is what I like to teach around anxiety. If we think about anxiety on a scale of 0 to 10, when we're at this 10 or 5, we're always trying to tell ourselves, don't be anxious. But you can't just go from 10 to 0. And anxiety is actually healthy, and this is what we don't talk about.
Okay.
0 to 3 is actually productive.
Why?
Well, think about when you were in school.
Okay.
And a test is coming. A little bit of anxiety causes you to study
harder,
stay focused, concentrate,
maybe
and
go
do
to bed
your
a
best.
little earlier.
Right.
Yeah.
So
good practice. Yes.
0 to 3 anxiety is actually productive.
Okay.
5 gets a little in the way, right? Because then you're kind of wasting energy on the anxiety that you could be using for productivity.
Okay.
10s are a complete waste of energy, right? You start to have physical symptoms, your stomach hurts, your heart's
thoughts, yeah.
So then it decreases productivity. But what happens when we're in this area and we're saying, don't be anxious, it's not possible. That's just so that it just makes us more anxious. It's like saying, don't think of an elephant. What are you thinking of right now, right?
Yeah.
An elephant.
An elephant.
Right.
Yep.
So as soon as you say, don't be anxious, it causes anxiety.
Okay.
So what I want you to think of is when you're at a 5, you're at a 10, you're just trying to go down a couple notches. So when you're at a 5, you can go down to a 3 pretty easy.
How?
Well, just like with those techniques of deep breathing,
Okay.
focusing, knowing that I don't have to get rid of it. Because I think that process of thinking I have to get rid of my anxiety just makes the anxiety worse. So knowing that you just need to bring it down a couple notches.
Okay.
And, when
acknowledging it and then saying, okay, let's
Yep.
recenter, breathe a little, and go back into
go
the world.
back, yeah.
Okay, good.
So let's use an example. You have a jam-packed day.
Uh-huh.
And
Something goes wrong in my day?
something goes wrong in your
Yes.
day,
Uh-huh.
and you are late for your next meeting.
Uh-huh.
What happens to you?
I get worked up because I feel like I'm letting people down that are waiting for me, and it's gonna mess up the flow of the rest of the day.
And they're going to think you're not perfect.
Right. Well, because I would be on time if I was.
Right. So, and then just going back to once you get really good at doing maps, I can do a map in my head really quickly. Like, okay, I'm anxious because blah, blah, blah. It's really pushing that button of wanting to be perfect, not being good enough. But it's really, okay, I just need to take a deep breath. I have to accept that I'm going to be late for this meeting.
Okay,
There's
and
nothing
they're
I
going to
can do.
understand because they're human, yes.
Even if they don't understand,
Okay.
right? Maybe they won't understand. Maybe there'll be a consequence to being late, right? Sometimes
There
those
is.
things happen,
Yeah.
right?
Mhm.
So it's not always, and this is my frustration on the manifestation teaching. Like it's taught like an all or nothing. Like if you just think positive, all of these things will happen. But it's really more like a putting the odds in your favor. So if you think about a coin, you flip a coin, 50% of the time it's going to be heads, 50% of the time it's going to be tails,
Yeah.
right?
Mhm.
That is normal ratios, right? If you are a positive thinker, you can change that to a 60, 70%. But you're not going to get it to be 100% positive. There are going to be things that mess up your day, things happen, but if you can focus on the positive, you can increase that percentage. But
Okay.
it's not 100%. So it's back to that balanced thinking. Anxiety is a continuum, positive thinking is a continuum, and just bringing those things down.
Okay.
Same with negative thoughts, but I think you're at a place in your life where you can nip these in the butt pretty quickly.
Get rid of them. I don't want those in my life anymore.
They might creep up. For me, not good enough ends up being a core connection. It comes up all of the time, but I also have been able to reframe it to say, well, that's why I'm so successful. Like I can, because I'm always trying to prove myself. But now I have insight into that, and I can stop letting it like mentally drain me.
Okay.
So it's more, again, about bringing these numbers down than trying to say, I can do anything, or you should be able to say I am good enough, but the reality is sometimes these things go so deep that it's hard to say the exact opposite. And so just thinking about, can I bring that down?
Okay.
Does that make sense?
Mhm.
What triggers you into these?
Um,
When something gets thrown off.
yes, yes, because everything's planned out to the minute.
Yep. And
And a mistake or a failure.
Mm-hmm.
Something that goes imperfectly.
wow, you're triggered all the time. So what I'd like to do is separate the trigger, because this you have no control of. You have control of this and you have control of this.
Okay.
We don't have control of this.
How important is it for us to remind ourselves that we don't have control of triggers, but we do have control of our thoughts and worries?
This is what makes the biggest difference.
Okay.
Is knowing that these are different categories. Like a trigger, you have to let go. Like the point here is to let go. Like you have to just accept it. They happen. You're going to make mistakes. But if you ruminate on that mistake, you're just putting fuel to this fire and this fire. So you're increasing these numbers rather than decreasing
them. Okay.
So triggers, but you can't just let these things go. They're actually part of the way that you think. So to clump it all together, say, oh, you just got to let it go. Well, I have to let go of the trigger, but I have to actually work on these things. Does that make sense? Mm-hmm. And the reason we separate grief is we have to feel this pain, and we don't do it in our culture. And the goal is to cherish this relationship, right?
Okay.
And you can imagine, it's not in your story, but if someone had trauma, how it messes with all of these categories, and it gets enmeshed together.
Do most people that you work with have trauma?
Here in the clinic, yes.
Okay.
So we have kind of two things that are going on. We have the Mentally Strong Clinic, which is for psychiatric care. People have a diagnosis, depression, anxiety, PTSD.
Okay.
And trauma is a continuum too. I mean, you can have, emotional abuse by one distant person in your family versus, a horrible physical and sexual abuse, right? Like, there's trauma kind of encompasses a lot of things, and that's why it's important to keep it in its own category. Because what did it do to you, right? For you, the grief changed the way you thought about yourself and the world. You can imagine what trauma does to people.
Well, that's the thing. Yeah. I kind of always confused trauma with grief until now, thinking that losing someone is trauma.
Well, it can be. Okay. I've lost 3 children, and I can tell you that grief can absolutely be trauma, but you still have to separate it, because the pain of losing someone, you have to feel that and cherish it. And cherish the relationship. Trauma. For me, with my daughter, it was enmeshed. Like, the day that she died was very traumatic for me, and her death is grief, right? But the goal of grief is to cherish the relationship. You don't want to cherish your trauma.
No, you got to get rid of that.
You got to, right? And so it's important to separate, and we're not doing that.
Okay.
So grief can have both. I mean, I have a friend who lost a child in a drunk driving accident, right? Like, that is both trauma and grief.
Okay. Got it.
So, but the goal, the power of choice, what you want to do with it is different. You don't want to, and people unfortunately do hold on to their trauma, and it creates pretty significant concerns.
Sure, because they don't know how to let it go.
Yeah. Well, and rightfully so. Injustices. People feel like they, this shouldn't have happened to me. They shouldn't have to let it go, and so. It's a process. It's not just so the Mentally Strong method is different because we separate those things, and oftentimes it just all gets enmeshed. I have stories of people who have been through horrific trauma. They have horrible negative thoughts about themselves, right? Yes, this is what started that, but they can control this. They can control this. They can control behaviors and choices. Many times people get into addictions, right? But it's separate. What are the things that we can control? There's such a biochemical component here with addiction, so it has its own category, but it's also a choice.
It is.
So being able to separate those things, I'm passionate about spiritual conflict, being a part of mental health. We're in an age where, sharing your faith is kind of like, people are scared to share their faith because they don't want to be accused of trying to push their faith on someone else.
Or judged by what they believe in compared to what others believe in.
So we've just kind of thrown the baby out with the bathwater, and we need to allow people space to figure out what they believe.
Okay.
Yeah. And how their past has, maybe positively or negatively influenced that. So. That is the mentally strong method.
Okay.